Hi, I'm Sabrina, and I'm going to be explaining how to perform CPR while Natalie demonstrates for me. So the first thing you want to do is approach the person in distress. See if the person is arousable by gently shaking or tapping them and asking if they're okay. Are you okay? If the person is unresponsive and they're not breathing, you want to immediately begin CPR.
That's like the standard now, is just hands only, not doing like 30 and then 2 breaths. I think now it's just the standard to continue hands only CPR until medical personnel kind of shows up and takes over, especially if you're not doing it accurately. So I think it actually might even be more effective.
Yeah, I agree. I think that I think like somebody in the general population that would come across the person who's unconscious or not breathing might be afraid to do mouth-to-mouth CPR. And so I think people are more inclined, if they're taught, to do hands-only CPR because they feel safer themselves.
Hey everybody, how you doing? There's one other thing that we really want to talk to you about, and that's how to properly take off a mask and gloves.
We really felt like we were being utilized. And I think that, and that's the reason really why Sabrina and I did reach out to PUHAC and Dr. Marsh. And we just kind of wanted to share how thankful we were for being utilized during this time. And it was just so refreshing to be back on campus and really feeling like we were doing what we were called to do in the first place, which is help people and give back. And it really just felt like being quarantined for so long and then getting it was just so exciting. And just like a nice fresh breath of air, honestly. So